Good evening everybody. Today we will be talking about a little rare topic which is cerebral venous sinus thrombosis. But this has now come into picture because of the advancement in our radiology and since we are able to diagnose much more rarer conditions in a better way. So we will be dealing on these topics: definition, pathophysiology, risk factors, the clinical presentation, the goals of the management and the trials related to it, and the prognosis of the disease. So what is cerebral venous sinus thrombosis? It is a stroke. So we have always studied about a cerebral arterial stroke, wherein it can be a ischemic stroke or a hemorrhagic stroke. Now this is a stroke which occurs on the venous side of the brain circulation, which leads to occlusion of one or more cerebral veins or the dural venous sinuses which drain all the blood from the brain. So the incidence is higher in the developing countries and it is seen more frequent in women, children and young adults. So the epidemiology accounts like it is around 0.5% to 1% of the selected stroke admissions, and it is about 3 times more common in women because this condition is usually associated either with pregnancy, puerperium or usage of oral contraceptive pills. There are other predisposing factors also, but the reason why it becomes more common in women is because of this. And contrary to its belief, it is more frequently found in children and young adults than the arterial or the ischemic stroke which we usually see in a later age 50 of the population. So what is the pathophysiology? So there are some venous sinus systems in the brain which drains the blood, which is like the superficial venous sinus system and the deep venous system. So these are sinuses which drain blood, they finally go into the internal jugular vein. And any thrombosis, formation of thrombus in these venous system results in cerebral venous sinus thrombosis. So you may question like why the thrombus? Again we go back to our basics of virtuous triad, wherein there is endothelial damage, stasis of the blood, as well as there is imbalance between the homeostasis between the prothrombotic and the antithrombotic factors, which results in the formation of thrombus. So as we can see here, we have the main venous system, that is the superior sagittal sinus, the inferior sagittal sinus, the sigmoid sinus, the straight sinus and the transverse sinus, which are the major venous system. And then you have the deep venous systems like the basal vein of Rosenthal, the internal cerebral vein, the vein of Laby. All these venous systems drain blood from various parts of the brain and finally enter into this internal jugular vein. So what happens? There is a thrombus formed either in these cerebral veins or in these sinuses, and because of the thrombosis definitely there is an increased venous pressure. So when there is an increased venous pressure, there is an increased venular and capillary pressure, which obviously results in decreased capillary perfusion, resulting in decreased cerebral perfusion, ischemic injury and a cytotoxic edema. In addition to this, there is, because of the increased venous pressure, there is disruption of the blood-brain barrier, which results in a vasogenic edema. And also because of the increased pressure in these venous and capillaries, it results in rupture of these minor tiny vessels, resulting in a parenchymal hemorrhage. That is why very much most of the times we see a cerebral venous thrombosis is being always associated with a parenchymal hemorrhage. In addition to it, what happens? There is a decreased CSF absorption, because predominantly the superior sagittal sinus and the inferior sagittal sinus as well as the lateral sinuses are the sinus which are responsible for absorption of CSF from the arachnoid circulation. So since there is a thrombus in these veins, there is a defect in the absorption of the CSF, resulting in decreased CSF absorption. So this decreased CSF absorption obviously will ultimately result in increased intracranial pressure and formation of hydrocephalus. So all these things contribute to headache, focal neurological findings, seizures, mental status changes. Like headache can be because of the hyperemia and the edema. The focal neurological findings can be because of the hemorrhage. Seizures is again because of the cytotoxic edema, and the mental status changes can result because of the increased ICP as well as the hydrocephalus. So what is the speciality of these cerebral venous sinus thrombosis? These venous sinuses lack valves. Unlike the other venous systems of the body, which is unidirectional in flow, the venous system in the brain lack valves. So the direction of the blood is in all the direction. Hence, the thrombosis which involves these venous sinus are involving the multiple areas of brain and extend across the multiple arterial circulation. For instance, if we have an arterial ischemic stroke, it is either confined to the MCA territory or ACA territory or PCA territory. But when we have a cerebral venous sinus thrombosis stroke, these are not confined to a single arterial circulation. It is, the classical presentation is, it is confined to a multiple arterial circulation. And the most frequently involved are superior sagittal sinuses and transverse sinuses. So, what are the risk factors? As already discussed, it is more frequently seen in females. So, all the risk factors associated with females like pregnancy, the puerperial state, usage of oral contraceptive pills are very common among them, and these things result in as a risk factor. Other than that, there are acquired as well as genetic factors. In genetic factors, we can have all these thrombophilia problems like factor 5 lead-in deficiency, protein C deficiency, protein S deficiency, hyperhomocystinemia, or the APLA syndrome, or the acquired you can have the nephrotic syndrome. In addition to that, infections like your simple meningoencephalitis or otitis, mastoiditis, your sinus infections or any systemic infectious disease can also result in formation of cerebral venous sinus thrombosis. Other autoimmune disorders like SLE, sarcoidosis, Behçet syndrome, Wegener's granulomatosis, or usage of substance abuse, drugs, lithium, neurosurgical procedures, trauma, all these things predispose you to the formation of cerebral venous sinus thrombosis. The entire whole picture is like, you have to remember, virtuous triad. So, whenever there is the circle of virtuous triad which is coming into picture, definitely there is a thrombosis which will be formed.